This conference will now be recorded.
Okay, good morning everybody. Is my voice audible?
Yes, sir.
Okay, right. So today we'll look into, again we'll review snakebite management, and also we'll continue with other bites. We have scorpion bite, and then we have cantharides. So these are the two, and then we have bee sting, bee and wasp sting. And then we have cantharidin poisoning. So all these three we will finish off, and then we can, by this, all the animal irritants poisoning. By today it will be finished, and in the next class we'll can see in the other chapters. So we know that this will be a review management of snake bite. We need to, the main point to be taken care of is whenever a person is bitten by the snake, the most important thing is psychological aspect. So the patient will have fear of death. So a doctor has to reassure the patient, because most of the bites are not poisonous snake bites, because only 1/3 are poisonous and most of the 2/3 are non-poisonous. So not every bite will be a poisonous. And then even if the bite is poisonous, not every bite is a wet bite. It can be a dry bite also. And mostly we have the diurnal variations. Suppose if there is a night bite, a person bitten at night time, it can be more dangerous when compared to a person bitten in the daytime, because snakes are nocturnal animals, and then they use this poison only in order to kill the prey for their food. So after night time means mostly that might have used it the poison, and then during daytime definitely the poison content will be less, and even if the bite is there, it will be only a dry bite. So there are so many aspects why every bite is not a poisonous bite. So the doctor has to reassure the patient regarding these aspects, that psychological aspect and stabilizing the patient is very important. So aim of this first aid in snake bite is to decrease the systemic absorption of the venom, and then to prevent life threatening complications by immediately transporting to the hospital. And number one is immobilize the limb. Immobilization is very important part of the treatment. We can use a long stick or whatever it is available, and then the joints above and below the bitten area should be immobilized. And the main aim of immobilization is to prevent the movement of the lung, so that the movement of the muscles will be at rest. And whenever at rest means the systemic absorption, less blood supply, and then the systemic absorption of the poison will be less. So whenever the leg is moving, the muscles will be activated, the muscles will be contracting, and because of the muscles contraction and relaxation, the more blood is necessary for energy. And then if more blood is necessary, more vasculature, more poison can be absorbed from the site of the bite. So immobilization is a method to prevent systemic absorption. Systemic absorption. So immobilization is a method to prevent systemic absorption, and we cannot elevate the limb, as it again accelerates systemic absorption. And then always make the patient to lie in the supine position or lateral supine position, and then we can transfer to the medical facility. So what we should not do is we cannot suck the poison or apply any ointments, or you cannot incise the wound, incise the bite wound and then suck the poison. You cannot apply the tourniquet. Previously, this method is used applying tourniquet, but tourniquet application is not advised. It has no effects, neither it is useful, and it has more harmful effects. How it is harmful effects means uh, it can block the arterial supply. It can, because mostly during this panic situation, the attender can tie the tourniquet very tightly, so that not only the venous supply will be blocked, the arterial supply of the limb can also be compromised. Because of this, the whole limb will be in a risk of hypoxia and in a risk of gangrene formation because of the lack of arterial blood supply. So this is very dangerous. So because it has no use, don't apply any tourniquet. Even if we want to apply, you can apply, but it should be in a banded way, not in a thread way, or not in a, we cannot apply a tourniquet with a rope. You can apply a tourniquet with a cloth, because the cloth will be of broad nature. So it will pressurize only the venous return. It will not block the arterial supply. So the tourniquet main aim is to block venous return and to facilitate arterial supply. So how do you know that the tourniquet is enough to block the venous supply and not the arterial supply is, after applying the tourniquet, you should be able to pass two fingers easily under the tourniquet. So if you are able to pass two fingers easily under the tourniquet, then it indicates that the pressure is enough to block the venous return from the limb to the heart and not the arterial supply from the heart to the limb. So this is about tourniquet. And then we cannot cut the wound, we cannot remove the venom, and then again, don't give anything by oral after snake bite. This is also very important. Whether coffee or tea or milk or water, nothing. Why? Because it increases again the energy consumption, and then it increases the metabolic rate. It increases the utilization. The system will function, the GI system will function again. It increases the blood supply and absorption. So any internal system should be under rest. So don't give anything by mouth, and then only after reaching the facility also we have to keep the patient for a few hours nil per oral, and then we have to give only IV fluids whenever it is necessary. So management, we know that ABC, we can give normal saline or lingual lactate, and then we have to take proper history, whether to identify the snake bite, where it has bitten, whether it is snake bite or not, and then history, how we have to how to identify a snake if they have brought along with the patient, whether it is a poisonous or non-poisonous, whether which type of snake it is, whether it is a viper, whether it is a crate, whether it is a cobra or a king cobra. So whatever it is, so we have to identify the snake if the snake is brought to you, whether dead or alive. And then examine by physical examination of the bite site, see whether there is edema at the site of the bite, whether there is swelling, there is bullae formation, oozing from the wound. Bullae formation is there in viper bites. So we know that viper bites have necrosis. Localized necrosis is a feature of viper bite, where there is intense oozing of blood from the bite site, and also there is necrosis of the local area. And then we have, so see whether any lymph nodes are palpable at the surrounding regions at the nearest region. Suppose if there is bites at the legs, then you have to check for lymph nodes at the groin region. So nearest lymph nodes can be checked for any swelling to know whether the inflammation is there or not. And then you can see the features of severe snake bite. We have seen there can be rapid extension of swelling, there can be early tender enlargement of the lymph nodes, early systemic symptoms, and then early spontaneous bleeding from the gums, and then early passage of dark brown color urine. So dark brown color urine is mostly because of the acute renal failure. Acute renal failure leading to dark brown urine. And then we have how to diagnose a snake bite venom by laboratory test. We have two tests, like 20 minutes blood clotting test and then ELISA test. And mostly this 20-minute blood clotting test is done in viper bite. We know that viper bite is a hemolytic toxin. Or we have, how to remember. I already told you viper bite. V starts with V, and then V stands for vascular. V stands for vascular poison. So viper bite, vascular poison. So any viper bite is hemolytic. So the blood will not clot. So normally, if the blood is undisturbed, it has to clot within a few minutes. In case of viper bite, the blood will not clot. So based on this principle, we will take the venous blood in the test tube and then we will leave it undisturbed for 20 minutes. Suppose, and then we will tilt this tube. If the blood is still in the liquid state, it indicates that blood has not clotted, and then there is some poison, mostly the viper bite poisoning. So this test is again repeated of 6 hours to see whether again the symptomatology has improved or not. So this 20-minute blood clotting test is used mostly not only for diagnosis but also mostly for seeing improvement, for seeing the prognosis. Suppose you have taken the viper bite and then you started treating the patient, and then after 2 or 6 hours or 12 hours, you will again check this 20 minutes blood clotting test, and if the blood is clotting, then it indicates that the patient is improving. Suppose the blood is still not clotting even after 6 to 12 hours or 24 hours after treatment, then it indicates that the patient is not improving. So it is mostly used for knowing the treatment aspect, whether the patient is responding to the treatment or not. And then we have ELISA test. ELISA test is very costly test, not available in every centers. It is there only in higher centers, but it is also a good test to identify the poison. And then there are other non-specific tests that can be done. You can do an ECG, you can do EEG. Then to know the kidney function, you can do a serum creatinine, and then prothrob midtime. All these things can be given. And then the drug of choice for snake poisoning is PAV, polyvalent anti-snake venom. The drug of choice, the DOC of snake venom poison is PAV, polyvalent anti-snake venom. Polyvalent anti-snake venom. It is prepared by 3 institutes in India. One is Hopkins Institutes, which is in Mumbai, and then another is King's Institute, which is there in Chennai, and then another is Serum Institute, which is there at Pune and Kasali. So these are the 3 institutes that will manufacture this PAV, polyvalent anti-snake venom. And then what is it contains? It contains all the 4 components of the major, the big 4. We call it as the big 4 in India. So what are they? They are cobra, kite, Russell's viper, and saw-scale viper. It's because most of the viper bites in India are caused by these 4 types of snake poisons: cobra, kite, Russell's viper, and saw-scale viper. So the venom polyvalent anti-snake venom is prepared from the venom of these 4 snakes. So usually these polyvalent anti-snake venom PAV is given 4 hours, within 4 hours of the bite for maximum effects. It is available in a powder form. It should be mixed with sterile water, and then you have to give it in a normal saline in a slow manner, and you have to see for any anaphylactic reactions. So 1 ampoule will neutralize about 6 to 8 milligrams of venom. So this is snake venom antisera or PAV. So treatment dosage is, we have to, I told you this is in a lyophilized form, in a powder form, so it has to be diluted in sterile water, and then this sterile diluted water or liquid should be mixed with normal saline. Normal saline, about 500 ml of normal saline, and then it is given slowly IV over a period of 1 hour. And then if the symptomatology is minimum symptoms in any poisoning, then 5 vials are given. There are no systemic symptoms, or there are mild symptoms, systemic symptoms, and then there is only local swelling. In that case, only 5 vials are given. If it is moderate symptoms, 10 vials are given. If there are severe symptoms, 10 to 15 vials are given. So moderate symptoms is where swelling is progressing beyond the site of bite with systemic reactions. Severe symptoms means there is both marked and systemic symptoms present. So in that case, we will give about 10 to 15 vials. So 5 vials, 10 vials, 15 vials. 5 vials for minor symptoms, 10 vials for moderate symptoms, 15 vials for severe symptoms. 5 vials only if there is local swelling. 10 vials, local swelling, a little bit systemic symptoms. 15 vials, both local and systemic symptoms are marked. So the dosage is same for both children and adults, and PAV is not contraindicated in pregnancy. If a pregnant lady is bitten by the snake, the PAV can be given. It is not contraindicated. In neurotoxic poisoning, the second dose of 10 vials after 1 hour can be given because of the more long-term effects on the nervous system. For signs of neuroparalysis, we can give neostigmine IM with atropine IV. Heparin can be given for clotting abnormalities. Heparin of 1000 to 5000 international units, and then we can give TT or a booster dose of TT if the patient has already taken TT, and then we can give broad spectrum antibiotics, mostly if there is local severity or gangrene formation or necrosis of the local bite area. And then if there is respiratory paralysis or respiratory distress, we can give oxygen either by normal tube or by mechanical ventilation. And then fluids and plasma, blood transfusions, if there is a severe fluid or blood loss is there. And then we can give normal pain relief and fever relief like paracetamol. And then aspirin should not be given because aspirin is it will not allow the blood to clot, so aggravating the bleeding. So paracetamol is the best drug in this case. So apart from the good effects of this PAV, we have also the adverse reactions. The adverse reactions of PAV can be of 3 types: early anaphylactic reaction, pyrogenic reaction, and thirdly late reactions. So early reaction occur within 10 minutes to hours of the starting of the treatment, and the symptoms are itching, urticaria, cough, nausea, abdominal pain, and then diarrhea, tachycardia, bronchospasm, angioedema. So all these things are anaphylactic reaction. We have angioedema where there can be swelling of the lips, swelling of the throat, swelling of the mouth, urticaria, itching, dry cough, bronchospasm, tachycardia. And then we have pyrogenic reactions where pyrogenic fever symptoms will prevail. There can be rigors, there can be chills, there can be fever, there can be hypotension, and it will develop within 1 to 2 hours after treatment. And then late reaction will develop about 1 to 12 days after the treatment. And the symptomatology is fever can be there, nausea, vomiting, diarrhea, itching, lymphadenopathy, and then you can have arthralgia, myalgia, body pains, and then joint pains can be there in a feature of late reaction. So whatever it is, so if it is within 10 minutes, early anaphylactic reaction. If it is 1 to 2 hours, pyrogenic reaction. If it is about 1 to 12 days, late reactions. So how to treat these adverse reactions? Again, you have to stop giving this PAV, polyvalent anti-snake venom, and then you have to give adrenaline. Give adrenaline 1:10,000 dilutions. Give adrenaline and repeat in 10 to 15 minutes if there is no improvement in symptoms. And then after improvement of symptoms, you can again start giving PAV in a controlled or in a low dose. So for a late reaction, oral antihistamines like chlorpheniramine and maleate can be given. So post-mortem changes, we have seen there can be fang marks on the affected limb, and then in case of cobra and kite, the puncture would be about 1 to half centimeters deep, and the affected area contains fluid and then hemolyzed blood, causing staining of the tissues. So if you cut open the tissues, definitely there will be staining under the surface of the tissues. So, and then we have a viper bite. Viper bite is also a puncture wound. It is about 2 or half centimeters deep, and is affected area is discolored, swollen, and then cellulitis. Very important. We have known that in viper bite, localized symptoms are more, like necrosis, bulle formation, so swelling, pain. So localized symptoms are very high in case of viper bite when compared to cobra and trade bite. So not much of swelling and necrosis is present in case of cobra and trade bite. Whereas in case of viper bite, most of the tissues are damaged and there is sloughing and there is bulle formation in the bite site and then the surrounding bite site. Medical legal aspects. Almost all cases of snake bites are called as accidental in nature. So all snake bites are accidental in nature. And then homicide has been occasionally reported in snake bite, release of snake in the victim's bedroom. And then it is known as by history Queen Cleopatra. Queen Cleopatra is believed to have committed suicide by having a venomous snake bite on her. So this is historical wise. Queen Cleopatra has been committed suicide by a snake bite. So both, but it is very rare. So suicide with a snake bite is very rare. We cannot see now. It is only a historical event. Homicide is also very rare, but it can be there. But by leaving the snake in the victim's bedroom, and then almost all snake bites are accidental. And then the person who is dying of snake bite, the government is helping with some monetary benefit also. So these are some of the myths about snake bite. So myth is, can snakes drink milk? No. No, the fact is the forked tongue of the snake is not adapted for lapping liquids. They usually fall sick when they are forced to drink milk. So normally snake will not drink milk. So next myth. Snakes like to listen to music. Fact is, they don't have the auditory organs. It is the movement of the snake charmer that forces the snake to follow a particular movement. So that is one thing. And next one is, snakes take revenge. Scientifically, the fact is scientifically that the brain of the snake is not developed enough to have memory to take revenge. So that is also a myth. And the number 4 myth is, snakes have supernatural powers. The fact is it is not. So the snakes will not drink milk. The snakes don't listen to the music because they don't have auditory organs. They don't drink because the tongue is forked. And then snakes take revenge. They don't take revenge. Even if you step on the tail of the snake, and then it will not come. Normally in old movies, it is normally seen that while a person traveling on the road and then he accidentally stepped on the snake and then he went to his home, but this snake has catched a and then he traveled to at night time till it reached his home. And the movies has it will be shown as if the snake has traveled under the surface of the car and then it has reached there. So all these things is just an entertainment. It is not true. So it will not take revenge. Snakes will not have much brain development, so it has no memory. So it doesn't involve in revenge taking. So next one is scorpion bite, bee and wasp bite. Now scorpion bite, there are about 100 species in India, and we have a hollow sting at the last joint of its tail, which communicates with a poisonous gland by means of a duct. So this is what is the poisonous part. So there is a hollow sting in the last joint of its tail, which communicates with a poisonous gland by its means by a duct. And the venom is more toxic than snakes, but only a small quantity is ejected on stinging, so acts either as a neurotoxic or a hemolytic. So scorpion bite, it can be a neurotoxic or it can be a hemolytic toxic. And the venom is again, it is a toxalbumin. Even the snake venom is also a toxalbumin, and it is a potent autonomic stimulator which releases massive catecholamines from the adrenals. This is very important. So scorpion bite is a autonomic stimulator which releases massive catecholamines from adrenals. That's why the patient will have most of the time cardiac symptoms, arrhythmias. So most of the patients, if the patient has to die with scorpion means bite means the patient will have arrhythmias, ventricular arrhythmias or atrial arrhythmias. So mostly the cardiac symptoms prevail in scorpion bite. So this is the scorpion. You can see the tail end. So the terminal part of the tail end is modified into a sting, and then it is connected with a gland, poisonous gland through the duct, and then it will sting. What are the clinical symptoms of scorpion bite? There is local burning pain, swelling, paresthesias. There can be sweating, salivation, vomiting, abdominal pain, mostly GA symptoms. There can be dilatation of the pupil, arrhythmias, very, very important, cardiac arrhythmias. And then there can be hypotension, fall in BP, followed by hypertension, convulsions, and then pulmonary edema and oliguria. Again, here you can see there is also renal failure. So local burning pain, swelling, paresthesias, there can be sweating, salivation, vomiting, abdominal pain, mydriasis, cardiac arrhythmias, hypotension followed by hypertension, convulsions, pulmonary edema, and then oliguria. What is the treatment? So management of ABC, again airway, breathing, circulation should be maintained. Check whether airway is good, check whether breathing is good, check whether circulation is okay or not, and then immobilize the patient at the bite site. Again the same principle in order to prevent systemic absorption. And then here we can apply local ice application, whereas in snake bite we may not advise it to apply ice at the site of bite, but here we can apply local ice application. And the treatment of hypertension is we can give nifedipine with prazosin, sublingual nifedipine with prazosin. And then for a hypotension, treatment of hypotension, we can give dopamine infusion. So for hypertension, sublingual nifedipine with prazosin, And for treatment of hypotension, we can give dopamine infusion. Diazepam can be given for convulsions. Furosemide can be given for pulmonary edema. And then scorpion antivenom is also present, which can be given. Most of the time it is not necessary because the dosage of injected venom is very less. So one vial in 100 ml of water can be given in a form of IV route. So these are some of the treatment aspect. So treat the hypertension with sublingual nifedipine with prazosin. Treat the hypotension with dopamine infusion if present. If convulsions are there, you can give diazepam. If pulmonary edema is developed, give furosemide. If the symptomatology is still not improved, then you can give scorpion antivenom. One vial in 100 ml of water, sorry, 10 ml of water as an IV route. And then bee sting or wasping. So what is the difference between these two? Almost they look the same way, but the wasp is a little bit bigger and the bee is a little bit smaller in size. You can see the stinger, it is pointed backward, bob, and then it rips out, killing the bee. So the bee will sting only once in a lifetime. Once it stings, it will die after stinging. Whereas in case of wasp, European wasp, there are small bobs and can sting repeatedly. So this is one major difference. The bee can sting only once in lifetime, whereas European wasp can sting repeatedly. Body type, hair is present all over the body in case of bee, and the color can vary from black or dark brown to golden with gray or amber bands, and they will be never bright yellow. You can see the bright yellow is only present in European wasp, and they approximate about 15 millimeters in length. So all these things no need to remember, no need to, this is just for knowing the difference and knowing how it looks. So nobody will ask a question, what is the difference between a bee and a wasp sting? Nobody will ask it. Only this slide is just for a general knowledge sake, how they are different and what is their morphology. So in case of European wasp sting, we can see it is a bright yellow legs with the body, and then we have a black triangular markings on the body, and there are few hairs. Whereas in case of honeybee, the body is covered with full of hairs, whereas in case of European wasp, there are only a few hairs, and then they are a little bit slightly bigger, about 20 mm in length than the bee. And then the food of the bee is pollen and nectar, whereas the food of wasp, they are predatory scavengers. They feed on dead bodies, and then they are attracted to sweet foods, drinks, and meats. So, what is the treatment of bee sting or wasp sting? So, there are three types of headings: local reaction, anaphylactic reaction, and then toxic reaction. Local reaction, anaphylactic reaction, and then toxic reaction. Local reaction, where there is pain, swelling, edema at the local site of the bee sting. It is dangerous to take out the sting if it is in vital location, like just at the neck. So don't pluck it out, because the sting has a horizontal, again the vertical sting has a horizontal bobs. So when you pluck it out, you are causing more damage. You're ripping the skin, along with again you are causing more injury to the skin while removing the sting from your body. So you have to use the scalpel to remove the sting from the body. So mostly it can be dangerous if it is the sting is in the mouth, because it causes increased swelling, and then it causes a reaction, anaphylactic reaction, where the mouth and the throat can be blocked because of the swelling of this reaction. So that's why it is not better to take out the sting as it is. but you have to take it under the supervision of a doctor by using a scalpel. So it can be dangerous when it is inside the mouth or near the eye. So it can cause swelling, lacrimation, hyperemia, and conjunctival chemosis. And then if the sting is in the cornea, it can cause scarring, and then it leads to keratitis, leading to blurring of vision. So these are some of the local reactions and the dangerous sites. The dangerous sites can be mouth, eye, and the cornea. Anaphylactic reactions. So anaphylactic reactions occurs in patients and persons who are sensitive to these allergic bees, and about 4% of the humans are sensitive to the stings, and the wasps cause twice as many allergic reactions as honeybees. And what are these anaphylactic reactions are? There can be facial flushing, urticaria, dry cough, dyspnea, wheezing, stridor, abdominal cramps, vomiting, diarrhea, and shock. And in case of severe cases, there can be angioedema, glottic edema, and then hypotension and coma can be a feature. So most of there is a facial flushing, urticaria, cough, dyspnea, and then wheezing, stridor. So respiratory symptoms will prevail. And then in severe cases, angioedema, glottic edema, and then profound hypotension and coma are the features. Toxic reactions. Toxic reactions in this, it is due to the venom itself, the sting itself. So the patient can have headache, fever, myalgia, vomitings, convulsions. Renal failure is one feature here. And then if there is a delayed toxic reaction, then the patient can have hemolysis, coagulopathy, and then thrombocytopenia, and the patient can have liver dysfunction and then DIC, disseminated intravascular coagulation. So in early stages, you can have vomiting, convulsions, fever, syncope, and renal failure. And delayed toxic reactions, the vascular symptoms prevail like hemolysis, coagulopathy, thrombocytopenia, and then followed by liver failure. What is the treatment of this bee sting? Apply cold compressions, scraping away the retained stinger with scalpel blade. Don't use forceps. So this is the thing, you cannot use forceps to remove the sting or by hand. You have to use the scalpel so that we can cut the surrounding barbs which are present on the sting. And the antihistamines can be given such as chlorpheniramine maleate or diphenhydramine. And then anaphylaxis, if there is anaphylaxis, you can give adrenaline injections along with antihistamines, steroids, and oxygen can be given. Analgesics for pain, and then bronchospasm. If the bronchospasm symptoms are there, we can give bronchodilator like salbutamol or aminophylline. And finally, cantharides. So cantharide poisoning is due to eating of insects, Cantharis, vesicatoria, or blister beetle. It is called blister beetle or cantharides. The trade name is Cantharis vesicatoria. So there are people who eat, they will kill it, they will dry it, and then make it a powder, and then they will eat it. So why they will eat it? Because it acts as an aphrodisiac. It is consumed as a false, because it is a false belief. Aphrodisiac is where it will increase the sexual desire. So it is called aphrodisiac, but and actually it is not. But still people consume it. They will kill it, they will dry it, and then they will make it a powder, and then they will consume it. So it is blister beetle or Cantharis vesicatoria, or simply cantharides. So what are the symptoms if taken? There can be painful and frequent micturition. There is priapism, which is nothing but painful erection. Painful erection, priapism. There is hematuria, anuria, followed by renal failure. There can be bloody diarrhea, and the treatment is symptomatic. and supportive, nothing specific is there. So the main symptoms in cantharides is priapism, where there is painful erection, along with the urinary symptoms, painful micturition. There can be hematuria, anuria, and then renal failure. The treatment is symptomatic and supportive. So that's all for today's class. Thank you for your patient listening. You can leave now. In the next class, we'll continue with the other new chapter. Thank you very much.